Now to a cancer nightmare story involving a South Surrey woman. When she heard she'd have to wait months for colon cancer treatment, she paid out of pocket for care in Bellingham. And as CTV's Shannon Patterson reports, she was shocked to discover that now the BC Cancer Agency says she can no longer be their patient.
Sheila Visick is a vibrant, active 60-year-old.
I row competitively. I travel internationally for work. So really sideswiped, caught off guard by a routine colonoscopy result.
It confirmed she has colon cancer. Surgery in late September determined it's stage 3.
BC Cancer Agency, when they did finally connect with me, told me it would be mid-November before I would see an oncologist. And I kind of lost it. I was like, what do I do in the meantime?
On October 4th, she contacted North Cascade Cancer Centre in Bellingham, where some BC patients are being sent for treatment. And the appointment she was offered?
October 6th. 36 hours later, I met with a man who honestly is going to save my life.
But chemotherapy for colon cancer isn't one of the treatments being covered for BC patients at the clinic in Bellingham. So Visick and her husband decided to pay out of pocket there, nearly $10,000 US for 4 rounds of chemo.
Timely, consistent care has to happen now. And we talked about basically a budget to get it going, thinking that we would start and then switch back to BC Cancer Agency.
In November, midway through her chemo treatments in Bellingham, Visick says she was told she'd been discharged from the BC Cancer Agency and was no longer eligible for support services here.
It felt very much like, yeah, you've rejected our core services. You don't get anything else.
In a statement, the BC Cancer Agency said, in some cases, patients who independently arrange to receive cancer treatment out of country do not require additional care and oversight from a BC cancer oncologist. In this case, they are followed up by their primary care provider. Visick doesn't understand why she can't be seen by doctors at the BC Cancer Agency alongside her chemo appointments in Bellingham.
I am their patient even though they've discharged me. They may not acknowledge that, but they're the single provider of cancer care in this province, and I'm a cancer patient.
While she's been told her chemo infusions are working,
I'm afraid of what I need in the future. I'm afraid that it won't be there. So fear of having to deal with BC Cancer again is pretty overwhelming.
So if she needs further treatment, the mother of 3 is likely to head back over the border, knowing it's an option many simply can't afford. Shannon Patterson, CTV News.